Welcome to the online lesson of Clinical Cantonese 臨床廣府話 provided by Family Care Physiotherapy Clinic. Today our topic is on stroke. Stroke 中風 Stroke is a common cardiovascular disease in elderly population. Then in this lesson, we'll go through some professional terms in Cantonese. It's mainly for healthcare professional, how to describe the condition to the patient. As we all know, stroke is caused by the cardiovascular disorder inside the brain. There are mainly two types of stroke. One, we call it ischemic stroke. Ischemic stroke, lacking of blood, usually caused by blockage. How to say ischemic stroke in Cantonese is 缺血性中風 5 syllable 缺血性中風. Later, when we talk about the hemorrhagic stroke, you find that the pronunciation quite similar. Remember, this ischemic, the 缺 start with the K sound. 缺 start with the K sound. Okay, this is official term, but when we say in the layman language, we call it the brain arteries are blocked. We call it in 腦血管栓塞. 腦血管栓塞. Okay, still a bit technical, so need to practice a little bit. Then is that other type is not caused by blockage. It's caused by the rupture of the artery in the brain. So it's the blood comes out from a part of the brain, but it stopped transferring to the other part of the brain. This is called hemorrhagic stroke. Hemorrhagic stroke. We call it in Cantonese is 出血性中風. 出血性中風. So it's quite similar to the ischemic, the first syllable, right? In this one, 出 is start with, you imagine like the T sound, 出 okay? 出血性中風. The severity of stroke can vary a lot, really a lot, from very mild transient stroke that almost like no symptoms to be a very serious stroke and even can cause fatal consequence. But on average, the major symptoms is because of the damage of half of the brain, then cause lost control of half side of the body. So we call it loss of control of half side of body is hemiplegia. In Cantonese, we call it 半身不遂. 半身不遂. Of course, in clinically, we will specify whether it's left side or right side. Remember the Cantonese of left and right. Left, 左, right, 右. Okay, let me make an example of left hemiplegia. We call it 左邊半身不遂. 左邊半身不遂. Okay, and then loss of control of. Then the patient, the presentation is muscle very weak. Muscle weakness is the presentation. Muscle weakness we call in Cantonese 肌肉無力. 肌肉無力. Or we say directly, lost control is called 失去控制. 失去控制. Of course, a lot of variation. Those are that you can describe the major symptoms of muscle weakness or loss of control. The loss of control not only affects the arms and limbs, but also the head and face. There are two major symptoms involving head and face areas about swallowing and speaking, involving the throat. About difficulty in swallowing, in our clinical terms, we call it dysphagia. In Cantonese, we call it 吞咽困難. Or in a layman term, we call it choking. Choking in Cantonese, we use one syllable to describe. 濁. 做. It's a little bit difficult to pronounce, so need to practice a little bit. Then for speaking, if difficulty in speaking, we call it dysphasia. Dysphasia. In Cantonese, we call it 失語. 失語, loss of the ability to speak. And also in layman term, it's rather easier to understand. In layman term, we call it unclear speech. In Cantonese, we call it as 講嘢唔清楚. 講嘢唔清楚. For layman, it is much easier to understand. How about the prognosis and the outcome after stroke? Usually we describe in different mobility levels. We have 7 categories, but I simplify in the 4 categories here, then easier to understand. Different category level is that the worst one is that the patient is unable to have the active mobility. We say is about bed bound. Bed bound, we call it 卧床. 卧床. If it is expected for long term, after half a year or 1 year rehabilitation and then no significant improvement, everything in chronic, we call it in long term is called 長期. 長期. I did not write here, but just remember it. Then if the trunk has some control, a little bit better than bed bound, they can be chair bound. They sit on wheelchair. Wheelchair, we call it sit on wheelchair. In normal term, we call it 坐輪椅. 坐輪椅. In more official term, we call it 輪椅輔助. 輪椅輔助. Okay, in more official. And then is one level higher than wheelchair bound. The patient can be walked with some assistance. Assisted walking we call it 輔助步行. 輔助步行. In layman term, if we call it, some people is holding, then we call it in Cantonese holding. It's called 扶. 扶. If we say in Cantonese, say he needs to walk with someone holding, it's called 佢行路要人扶住. 佢行路要人扶住. Yeah, so better. I think this one, assisted walking, is the most common category. So better to practice this term a little bit more. Of course, the best outcome is the patient. They eventually can walk independently. Then they can go out independently. Then we call it independent walking. Is called 獨立步行. Officially we call it 獨立步行. But we prefer more the layman term. It says he can walk himself. It's called 佢自己行. 自己行. Then this is the best outcome we expect. And more important is that what treatments we can offer for the patient who suffer from stroke. For the medical side, there are 2 main types of drugs the doctors need to prescribe to the patient. If it's not the 2 main types, feel free to put in a comment what other drugs I need to translate for you. One, because most of the stroke, especially hemorrhagic stroke, is due to hypertension. They give them some drugs to control the hypertension if they did not have it before. Drugs for hypertension, we call it 血壓藥. 血壓藥. Definitely we have mentioned in some lesson ago, but good to revise. And the other one type is for them, we call it blood thinner, to let the stickiness of the blood decrease. So blood thinner, we call it 薄血藥. 薄血藥. Of course, those are the very layman term. Layman can understand. The very official terms, I need to find it out, but you use layman term better because it's better for mutual understanding. Okay. For rehabilitation training, how they do rehabilitation means that return to their normal life as much as possible. Rehabilitation training, we call it 復康訓練. 復 Hon Fan Lin. It is not a single healthcare professional to do it. It involves few healthcare professionals to work together as a team to help patients. The two main types of rehabilitation for strokes, including my profession, physiotherapy, to teach the patient how to walk, how to regain the mobility. Physiotherapy, 物理治療，物理治療。Another type of professional treatment is speech therapy, which help the patient to recover the ability of speaking and swallowing. So don't be confused by the term speech, because they also involving swallowing. Swallowing is rather important. Speech therapy we say in Cantonese 言語治療，言語治療。So this for today's lesson. Of course, stroke is a big topic. If any particular vocabularies you want me to go through, or any other more common terms you think I missed it, please type in a comment. I will try to answer you or make another video for that. But for the general topics, what treatment is the best for stroke? As always, as other conditions, prevention is the best treatment. We found it is medical research. We found that it's a traditional Chinese martial arts, Tai Chi Chuan. Tai Chi is very effective in controlling the blood pressure, reducing fall, and definitely can help the patient to prevent stroke. In Hong Kong, China, or some place like Taiwan, some of them they have a group to practice Tai Chi every day. It's a very good, meaningful exercise. Tai Chi in Cantonese we call it Tai Ging. Tai Ging. Then the verb to describe practicing Tai Chi we say is 打太極. 打太極. I think it's a very good spot to promote. I really hope this country will promote more group exercise and effective group exercise to prevent stroke. Thank you for attending the lesson today. Thank you very much.